Lesotho, and it on Wednesday confirmed its first case of COVID-19, making it the last African country to report the disease. With the announcement, all 54 countries in Africa have now reported cases. The COVID-19 has been slow to spread in Africa, but cases are rising across the continent. More than 69,500 cases have been confirmed, with more than 2,400 deaths, according to the Africa Centers for Disease Control and Prevention. Today also marks the third month since Egypt reported Africa's first COVID-19 case. To help us recap the challenges and opportunities that face the continent in the fight to overcome COVID-19 is Doreen Ninina Hazwe, who is the One East Africa Director. Good afternoon, madam. Thank you so much for joining us here on Bottomline Africa. It is now, COVID is now in all the 54 African countries, being the third month since Egypt has, recorded the first case. How have we managed it so far in those 3 months, madam?
First of all, thank you very much for this invitation. So just maybe a quick recap. Let's remember that before the crisis, the health crisis arrived in Africa, we were faced with an economic crisis when we had the prices of commodities for export fell. We have our tourism dropped, and that had a big impact on our economies, our currencies, and remittances. So when the health crisis arrived, we had to go on lockdown and curfew, and that also impacted people who earn a living daily, and we also had to put a lot of businesses on hold. So we have about 30 million people who are at risk of losing their jobs, and we also have the debt crisis. And it's also important to remember that even before this health crisis arrived, we were faced with severe food shortages on the continent due to flood, drought, low-cost invasion, conflict. So it has not been easy for this continent to manage. But we are lucky that our government, with the support of the African Union, have been talking in one voice and collaborating to find a solution. So far, we are trying to manage this. As you rightly said, we are about 69,000 people who are affected on the continent and about 2,400 deaths. So we are still managing it. It's much lower than what we've seen on the rest of the world.
Indeed. Let's talk about some concerted efforts by the heads of state of East Africa, bearing in mind that just days ago we had the East Africa Heads of State Special Summit to discuss the region's management of COVID-19, and among certain issues that were highlighted from the virtual meeting, if I'd put it like that, was the issue of the cross-border spread. Of course, saying that we need to have an uninterrupted cross-border movement of goods, because this is really important. But then again, we have seen a surge in the truck drivers who are testing positive for this COVID-19. So how much better can we manage this situation, madam?
So thanks. So as you said, we need to work together. I think the key here is to continue to collaborate, for our leaders to continue to sit down and try to find a solution together. And even at the African Union level, they started what they call the Africa Joint Continental Strategy for COVID-19 outbreak, where we want business to continue, especially when it's the free movement of goods. We need to continue working together and get all the businesses and business leaders to find a solution together, because you've said we've seen that the number of COVID cases in the truck drivers who are moving these commodities is on the higher rise, and we've seen that there are countries on this in this region like Burundi and Tanzania that are not yet on lockdown. So there's a fear that with that the spread of COVID-19 will be even higher. But the only solution is to continue to collaborate and find a solution.
Indeed. And you've mentioned Burundi and Tanzania, and that's where I was coming, because those two heads of state did not attend that virtual meeting. And for instance, Tanzania, it's not the first time that they're not attending. Yet, as you say, they're not yet on lockdown. They've sort of like been among the hardest hit, if I'd put it like that. What does the absence of these two leaders, John Pombe Magufuli and Pierre Nkurunziza, mean?
So I think that's a question that could be asked to them. I wouldn't be able to comment on that, but I have a feeling that they are consulted. So it's not that they are put on the side. So they probably know what is going on and the solutions that are being put on the table. So that question, really, I won't be able to answer, but I know that the East African community is strong and we continue to bring everybody on board.
Indeed. That's fair enough. So there's a time that the Director General WHO, Tedros Adhanom, had said that Africa should prepare for the worst. Yes, we have been fortunate enough not to record high numbers or high cases of COVID-19 compared to other continents, rather. But then should we still keep preparing for this worst?
Yes, I think it's important to keep preparing because we don't know what will happen, although our government are doing amazing work to control this pandemic. And that's why we see a low number of infected people on the continent and low death rate. So yes, it's important. And, leaders had met in 2001 to agree to a 15% towards 15% of their budget to go towards health. So I think this is an opportune moment for them to fulfill that commitment, increase their funding for health so that we can be prepared. We are lucky that we have fewer cases, because if we had more cases, our health system, unfortunately, wouldn't have been able to absorb the number of cases. But it's really important to keep up this fight.
Indeed, still on that, the same question on preparing for the worst, because today WHO said that this could now move from being a pandemic to an endemic, meaning it will last. It will be with us for a while, just like HIV has been. I mean, it's been there forever, if I'd put it like that. So how else should we now start preparing or adapting to this quote-unquote new normal?
Mm-hmm. So we've seen a number of African leaders coming forward and speak of the new measures that will be in place once they ease on the lockdown, how people need to protect themselves, how we need to use these PPEs, and how people should avoid living in or being in large numbers and gather for events that we used to hold. So there are a number of things that we need to put in place, and that requires a lot of reflection on our part, but also on our government to see how to limit the spread. For us, we believe that none of us are going to be safe until all of us are safe, and that's I feel like unless we have a vaccine, we won't be able to feel like we have put a stop to this pandemic. And as you said, and we know that vaccine take a long time to work. So we'll be looking at about maybe 1 year or two before we have a vaccine.
Okay, we've talked largely on the challenges. Let's now speak about the opportunities, if any, that have, showed up as a result, or that we are having as a result of this COVID-19, madam.
Yes, so the biggest opportunity is to realize that, we are one community, we are one world, and we need a global solidarity to handle this pandemic. So the world needs to come together and find a solution. There are the G20 countries that have already met and agreed on a debt hold for the poorest countries. So that's a first step to help our government to handle this crisis, but also to have our economies go back on track. So that's what needs to happen, just a global solidarity. We are also calling, there are a number of voices that are now calling for debt cancellation. so that we can use the money, and especially on this continent, to deal with the crisis. So the main opportunity is the global solidarity and realizing that we are one. And we need to tackle this. I said earlier that none of us are safe until all of us are safe.
Indeed. Lastly, Madam, before I let you go, you mentioned the economy, and we've been having conversations on reopening our economies. Maybe you could talk to us about that even as you give us your closing remarks, Madam.
Thank you. Thank you so much. Yes, it's important to get our economies back on track, because our people are suffering. Yes, there's this pandemic that is raging on the continent, but if our people are not able to produce food and to live, we will be faced with other crisis, and we know that we don't want to be dealing with two crises at the same time. So really looking forward to measures that will be put in place by our government so that our economy can restart. We need to encourage on our side as one campaign. We are really working to campaign so that the leaders all over the world can understand that they need to put a plan in place for the world's most vulnerable, and those are the poor people. So there's need to be an economic stimulus. The African Union Ministers of Finance have talked about a stimulus package that needs to be given to African countries. They talked about $100 billion. Now we're looking at 200 billions because they estimated that we need 100 billions to deal with the crisis, and then another 100 billion to inject in our economies to be able to get back on track. So that's what we are campaigning for, and that's what we are calling the world to do, just the global solidarity.
Indeed. Thank you so much for taking your time to, speak with us here on Bottomline Africa. That is Madam Doreen Ninina Hazo. She is the One East Africa Director, just discussing matters coronavirus in Africa. Now that all the 54 countries in Africa have recorded cases of COVID-19, and today being the third month since, of course, Egypt recorded its first case of COVID-19, being the first in Africa. Thanks once again, Madam. Let's move on